going to be doing a physical assessment today. My name is Rebecca. I'm going to be doing it. Could you please tell me your age?
23.
Alright, your sexual development seems appropriate. Female, your posture is erect, slightly leaned forward, but appropriate. You're well groomed and well hygiene, and your facial expressions are appropriate to what is being said. The patient is alert. Could you please tell me your name?
Cassandra Van Middlesworth.
Could you tell me the date?
October 3rd, 2011.
Alright, and where we are?
Cox South Hospital.
Alright, could you please repeat these numbers for me? 52734.
52734.
And can you tell me what you had for breakfast?
I had some scrambled eggs and turkey sausage.
Alright, and where did you go to kindergarten?
Hope Township.
Okay, what is your highest level of education?
I've graduated with an associate's degree and I'm working on my bachelor's.
Alright, can you answer a few questions for me? How are ball and orange alike?
They're both round circular objects.
Alright, canary is to bird as beagle is to
Dog.
Alright, could you please repeat these letters? BMP.
BMP.
And these words, light, tight, dynamite.
Light, tight, dynamite.
Alright, your actions and decisions seem realistic and appropriate, and so do your mood and your affect. So now we're going to move on to your head assessment. And your skin seems intact, no lesions of any kind. Your hair color is blonde, brown at the roots, and it's smooth and well groomed. And now I'm going to check your skull contour.
Okay.
And there are a few bony prominences, which is expected and normal. Now I'm going to check your temporal pulses. And they're equal in strength. I'm going to check your sinuses. Do you have any tenderness?
No.
Alright, and if you did have tenderness, I would do transillumination. I'm going to check your TMJ now. Could you please open your mouth? Alright. Very good. And could you please close your eyes and tell me when you feel something on your face?
Now. 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 Now.
Alright. Could you please raise your eyebrows and bare your teeth and smile real big, puff out your cheeks, and push against me. Alright. I'm going to move on to your eyes now. Your eyelids are intact, and so are your eyebrows, and your eyelashes look well groomed and appropriate. They're brown in color. I'm going to check your lacrimal apparatus now. They are appropriate, and your conjunctiva are pink and moist, and your sclera are white. You have a few veins in your eyes. I'm going to check your accommodation. Your pupils are round. And could you please look at the clock? And look at my nose. Alright. And let's see. Right now we would do the Snellen eye check. And I don't have one, so you would stand 20 feet away, read off the Snellen chart. Also, could you please read what's on this, the first sentence?
The sky is blue and the grass is green.
Alright. We're now going to do the cover-uncover test. So could you please cover up your right eye, look straight at me, now uncover it. Alright, now do the same with your opposite eye, and cover it. Very good. Now keep that piece of paper. We're going to check your peripheral vision. Cover up one of your eyes. And tell me when you can see my pen light. Now. Alright, now do the other eye. Now. Alright. The corneal light reflex was intact. It's already checked with my pen light. And I would now use the ophthalmoscope to check your inner eye. And I would see the structures and that your lens is intact and your disc is intact, and I would see all of your vessels in your eye. And I would also check your red reflex. Now I'm going to move on to your ears and check their size and shape, which are appropriate. Your external canal is intact. And I'm going to pull on your tragus here. And I'll be doing this on both ears. And I would now do an inner ear check. And I would see your tympanic membrane and that it was whitish gray, and that there are no scars or anything. And it's intact. And so now I'm going to do the whisper test. I'm going to whisper something and have you repeat it to me.
We are doing an assessment.
All right. And now I would do the Weber and Renee test, which is where I take a tuning fork and I would place a midline on the head, and you would tell me whenever you stopped hearing it, and if it was the same in both ears. And then I would also do the Renee test, which is where I would take the tuning fork and place it on the mastoid process. And whenever you stopped hearing it there, I would pull it out to right outside of your ear, and you would tell me whenever you stopped hearing it there, and the air conduction should be longer than the bone conduction. Now we're going to, I would do that on both ears. Now I'm going to move on to the nose, and it is small and rounded, appropriate. Your nasal septum is midline. Your nasal mucosa is pink, moist, it's appropriate. And I'm going to check the patency, so can you still breathe?
Uh-huh.
Can you still breathe?
Uh-huh.
All right. And could you please close your eyes and tell me what you're smelling?
Okay. Smells like an alcohol.
All right. Now I'm going to move on to your mouth and your lips. And your lips, and could you open up your mouth, please? And your oral and buccal mucosa all look pink and moist. And they're intact, no lesions of any sort. And could you please say ah?
Ah.
All right, your uvula is midline. Your tonsils are appropriate, not enlarged or anything. Your palate is intact. Your tongue is pink and it has some a few ridges and bumps on it, moist. And your teeth are slightly yellowed, but appropriate. You don't have any fillings that I can see, and don't have any dental appliances. And I would also check your gag reflex right at this point, and I'm sure it is there. And now I'm going to check your neck. So tell me if it's tender at all.
Mm-mm.
All right. Checking your trachea, and it is midline. And your thyroid is not enlarged or anything. It is appropriate. I'm going to check your carotid pulses one at a time. And I'm also going to check your lymph nodes. All right, could you please move your neck in a circular motion? Okay, push against my hand, on this side, and raise your shoulders. All right.